Good afternoon, everyone. It's a great pleasure to be here, quite literally. Louis Pasteur was known to have said, "Fortune favors the prepared mind." Well, I believe so does luck favor the prepared. 7 months ago today, January 24th, 2014, for me was a most unusual day. A confluence of events came together that day, both good and bad, but none of which were supposed to have taken place. And it's the reason I'm standing before you now. On January 24th, 2014, I died. Now, to do the story justice, I had to give you a little background, set the stage for this little drama of my life, if you will. As you've already heard mentioned, I'm a urologic surgeon and I practice at Marian. I like urology for many reasons, one of which is I like the cutting-edge technology, the cool gadgets of our surgery. And for instance, that day I was using the Da Vinci robotic system, all set about to do a radical prostatectomy. Shout out to you all from the foundation for making that purchase possible a few years ago. Thank you. I get to help people fix real health issues like prostate cancer, but without that sense of urgency that is so often involved with issues of the heart. Which brings me to point 2. Most of the time, urology is very predictable, boring even, and that's a very good thing because I hate emergencies. I like my surgeries to be uneventful, minimally invasive, and to have a very quick recovery. Which is why I always do surgeries on Wednesdays. All my big cases are on Wednesdays. The patient does well, goes home in 2 days, I get to have the weekend off. This was the first unusual fact. January 24th was a Friday, and I was in the operating room. I never schedule surgeries in the hospital on Fridays. I should have been seeing patients in my office that day. And if I was, I would still be dead. It's true. The second thing that wasn't supposed to happen on January 24th was my heart attack itself. I mean, come on, I'm a 48-year-old healthy doctor. No history of health issues, no family history of heart disease, no chest pain, no shortness of breath, nothing. No warning signs at all. 1 minute, I'm in the operating room preparing to operate. And the next, I'm down on the cold floor, dead as a doorknob, in full cardiac arrest. Like many surgeons, I tend to be a little superstitious, and I do believe in luck. Luck is a very precious commodity, and I do not consider myself typically to be a lucky guy by nature. In fact, I used to say that I've been truly lucky only 3 times in my life, and those 3 times are named for my wife Stacy and my 2 kids, Rachel and Charlie. They are the greatest gifts of my life, and I never risk pressing my luck. But obviously, on January 24th, I was incredibly lucky. I was found on the floor by one of our excellent surgical techs, Gerard. He kept me alive with chest compressions and called out a code. Cracked a few ribs, too, while he was at it. But that's okay, I'm not complaining. The rapid response team was, fortunately for me, very rapid and very responsive. A couple of our anesthesiologists, I know Dr. Robertson's over here. He was part of the team that kept me alive. A shout out also to Dr. Bean, who I didn't see here, but she was also part of the team. They got to shock me twice. That was excellent. Got my heart started. Dr. Harrison, Dr. Schultz rushed me off to the Heart Center's cath lab. And there, Dr. Harrison and Dr. Ginkle fortunately found the short but complete blockage of one of my heart's arteries, dilated it, and stented it open. Again, I was incredibly lucky. There's a reason my kind of heart attack is called a widowmaker. But because of the exceptional skills, the timing, and technology of Marian's Heart Center and all of its team members, I was able to walk out of that hospital after just a couple of days, return to my practice the following week, and return to the operating room just 1 week after that. With the recent passing of Robin Williams, I'm reminded of an early scene in the movie Dead Poets Society where the mathematical greatness of a poem was supposedly calculated. Some time ago, I came up with my own definition of what I consider to be a miracle. A little mathematical definition of my own. And I decided that a miracle is an event that occurs whose need is incredibly great, but whose likelihood is equally or as much incredibly rare. And I profess to you that at Marian's Heart Center, they perform miracles like this every day. But I ask you this, what would have happened to me on that Friday, January 24th, if the cath lab had not been available? What if another patient was already on the table? Would my outcome have been as exceptional? When I woke up in the CCU after several hours and saw Dr. Canvasser staring at me, I was a little frightened as to what had happened to me. I was quite fortunate that I did not need the assistance of a cardiac surgeon that day. So I stand before you today to put the needs of Marian's Heart Center expansion front and center, and to help you give those needs a face and a name. Luck favors the prepared. This aging population is expanding, and we need this expansion so Marian's Heart Center will always be equipped to perform miracles. Thank you for your kind attention and your generous, deep generosity.
Thank you.
Thank you.